This is the anesthesia area. We have kennelling here for pre and post inductions. So we normally bring the animal through from wards. The animal will be pre-measured in this area. We will then be able to monitor the patient and just keep an eye on it pre-induction, and then it is taken through to one of our anaesthetic rooms. So this patient is anaesthetised and is being prepped ready for surgery. Once it's prepped, it will then be taken through to theatre. So this patient is being prepped ready for theatre. The hair is being removed. It's important to do that on the day of the surgery rather than pre-prepping. Once the hair is removed, we will vacuum the limb. We will then put bandage around the foot, because the foot is always the most contaminated area. The leg will then be scrubbed using gloves, using a grid technique and chlorhexidine. So it will be one way and then the other, and it is until the area is cleaned, and it will be the whole limb that is cleaned. Once the patient is in theatre, it will then be scrubbed again using chloroprep, which is chlorhexidine and alcohol, in an applicator. After the operation, any non-critical patients would be returned to this area. They would then be monitored and their analgesia would be assessed, and then once they've suitably recovered, they would then be transferred to the ward area. Any critical patients would go straight through to intensive care. So in theatre we have a one-way system. We normally come out of the changing rooms, scrub up, and then once they're scrubbed up, we would head towards the theatre. To enter the theatre, we'd normally use our back, push through, and then you'd proceed to put your gown and gloves on. After the procedure, then you would leave by the front door of the theatre, which is where the patient would normally enter. At the end of the procedure, the trolleys of all the dirty instrumentation would then leave this way as well, so it follows a clean to dirty route. This is an orthopaedic theatre which is solely used for orthopaedic procedures. The ventilation system in here is a positive ventilation system, which means the air comes down and out, so if there's any dust or hair, it doesn't come into the room. Within this theatre, we have the anaesthetic machine with the piped gases. This is the oxygen, the white. The blue is the nitrous oxide. And then we have the scavenging system, which takes away the anaesthetic pollution. The operating table is adjustable so that the height can go up and down according to the height of the surgeon. We have a bear hugger, which is a warm air device. It's connected to the blanket, which can be put over or under the patient. And then we have the suction, and that's used for if we're lavaging out a wound or any part of the animal, and then the blood or fluid can be sucked away. We have the cautery unit, which is for bipolar or monopolar cautery, so that the surgeon can coagulate any blood vessels as they're operating. And then over here we just have the procedure pack ready for the operation and the instrumentation on a separate trolley. And in this direction we have the Mayo stand ready for when we will gown and glove the surgeons after they've come from scrubbing. If you didn't have the luxury of multiple theatres, you would normally plan your surgical day according to your procedure list. So it may be starting with your orthopaedic procedure and then moving on to any clean contaminated procedures such as bladder surgery, abdominal surgery, and then any dirty procedures should be done outside the theatre area, and especially something like dentistry, which would aerosol all the bacteria. This is a soft tissue theatre with we can have two stations in here because we've got the double sets of lights. The lights can be removed and then sterilised and then returned to the surgeon, sterilised. They will then attach them in themselves, and so then they can adjust the lights as necessary. In here we have this is our checklist, and this is the charging sheet for the patient. It's actually covering the details of the patient at the moment. And during the operation, we keep track of the swabs, the blades, and the needles, and also the instrumentation as well that we've handed in. Just so at the end of the procedure, we do all of our instrument and swab counts and make sure that nothing's been left in the patient. If you're using a dual theatre, you have to take careful consideration of what you're putting in the theatre together. They must both be clean procedures to avoid any cross-contamination. So this would normally be suited for doing elective procedures such as sprays or neutering. At the end of the procedure, the dirty instrumentation would be taken towards the washroom on the dirty route. We will follow the route of the trolleys we take. So this is the washroom where the dirty instrumentation would be processed. They would be loaded onto trays, counted, and all the box locks opened of the instruments. They would then be placed into an instrument washer or ultrasonic cleaner, depending on the instrumentation. Once the instruments are cleaned, they are taken through to the clean area. This is where instruments are packed and made ready for sterilisation. This is the packing room where instrumentation is brought through, packing and getting ready for sterilisation. This is an orthopaedic saw, and it's labelled with an indicator for sterilisation. So it's a time, steam, temperature strip, which will change colour when exposed to steam for the appropriate length of time, which is 3.5 minutes. This item is going to be double packed so that it makes it easier for the surgeon to handle it aseptically. We've also had to place an extra layer under this item because of the weight of the item can potentially make holes in the drapes. This item has been singly packed in a sealable pouch. It's double packed to give it extra security in case there's any punctures, and makes aseptic handling easier. This item has got indicators on it to show that once it's been sterilised, these will change colour. We will also stamp it with the sterilised on date. These items are just about to go in the autoclave. They've been labelled with the item and also the person who's packed it for a quality control check, and also the sterilised on date, so we know how long it will be before it needs re-sterilising. So an item like this should be re-sterilised within 3 months. This tape is Bowie dippy tape, which will turn stripy when exposed to steam. The packs will be brought through to the autoclave room. And here we have a sterilised pack. So you can see the Bowie dippy tape has changed colour, so it's been exposed to steam. In the autoclave room, we will head to the surgical store. In the surgical store, we have it organised for orthopaedics, soft tissue, and then on this side is laparoscopic and hip replacement, because we don't do as many hip replacements, so it's in the far corner. In the bins on the floor is all of our procedure packs. These should be kept away from the floor. The instruments are organised into separate boxes. Ideally these would be in a covered cupboard rather than open, just to prevent dust coming onto them. In here we have a guide to help people find instrumentation. So, for example, if we wanted to find a Langenbeck retractor, it is in yellow area 2. So we go to the yellow area, which is marked here, area 2, and here on shelf 2 we find our Langenbeck retractor. These trolleys are what we call our fire trolleys, and were bought in response to a fire that we had when the tumble dryers produced a lot of smoke which came into theatres, and we needed to evacuate the animals. We found it very difficult to manoeuvre the animals out of theatre with the anaesthetic machine and the trolley, so we've bought this unit as a precaution for any future events. The trolley self-contained with a cylinder of oxygen, the anaesthetic vaporizer and the trolley combined. This is what we refer to as the clean corridor. All instrumentation is outside of the theatre, so any supplies or consumables are kept in covered cupboards, and we have supplies such as our saline, which is kept warm in an incubator. We also have various stations for our sterilium, if that's used for surgical preparation. We have our trolleys of our clean instruments ready to go into theatre, ready for procedures. And supplies that we'll need quite readily, such as gowns and gloves.